I was excited to be able to, deploy and do all kinds of stuff that Rangers get to do. 2006, we had a guy detonate a suicide vest, pretty much close proximity to our entire platoon. After that, started noticing some kind of weird things going on. I was having a lot of problems with headaches. I started noticing a lot of balance issues as I would go throughout my day. Towards the end of my day, I would have a really hard time even putting one foot in front of the other. I started figuring out that I really needed to start getting some help.
A lot of these folks are dealing with what we call the invisible wounds. And so when they walk into a room, people look at them and they don't see anything going on. They don't realize that they're really struggling. That takes a lot of courage to stand up and ask for that help when people can't see that there's an issue.
The first time I came to the campus, I was actually really impressed with the amount of people that they put together and the expertise that each one of those people brought to the program.
At the Marcus Institute for Brain Health, we really focus on an individual approach to each patient.
The clinical model is an interdisciplinary model where all of the specialists you'd need for that complex medical condition are all in one place.
Everything from your typical traumatic brain injury clinical things like neurology, speech pathology, physical therapy, behavioral health treatments, but on top of that, all the integrative therapies from art therapy, canine therapy, yoga, heart math, trying to make sure that the folks that are coming to us with these complex issues are being treated just as complex as they are.
The team works together every day with the patients that come here, and the patients don't have to figure out how to link it all together. We do that for the patients.
My buddy just really kind of told me how good the care was and how much they were addressing and how he got a lot of his questions answered. And I think maybe that's kind of something that all of us are looking for. I wanted to make sure that I wasn't just making this stuff up in my head, if that makes sense.
Bernie Marcus, as the world knows, is a very successful businessman and entrepreneur. Our military is something that he feels very strongly about. And so the injuries sustained in the military service, especially traumatic brain injury, has become one of his passions.
What we're trying to do is to set an example and get all of these institutions for the first time to operate as one unit with one desire of doing what you do best. But let's share information, let's share techniques, let's share all of the knowledge that we have and the data that we have so we come up with the best treatments that there possibly are, so we can have an effect on more kids now than we ever have before.
The reason that the interdisciplinary care works is because no individual practitioner can help all the different things that an individual patient experiences. But what can happen with crossing over and shared information real time, each practitioner learns from the next. And under those circumstances, the level of sophistication and care is elevated.
The patients that we see have all had these traumatic brain injuries, and more often than not have had more than one. And when you start having more than one traumatic brain injury, a lot of times, that's when that symptomology will come back.
What I really want is for nobody to really know that I ever went to war. It's not that I'm not proud of what I've done, I just don't want to have any of the effects.
We've had folks that have come in here with their shoulders down at all times. You can just tell they're not happy where they're at in life. And the transformation we've seen is groundbreaking. I mean, you see this at the end of these programs where these folks, they actually have a sense of humor again, and they have this glimmer of hope in their eyes that they didn't have before, and that's really why we're doing what we're doing here.
I've got twin daughters that are actually being born, and I'm really grateful that I got to do the Marcus Institute before this. I'm going to be better at everything as far as being a husband, father, all that stuff.
The biggest thing on the horizon for the Marcus Institute for Brain Health is replication. Right now, we're really focusing on creating an amazing program, not just in medical care, but also as to how the public and private partnership can work when it comes to healthcare.
If this kind of care is more readily available for veterans, I think that we would see far less problems with veterans coming home. It's worth every hour, day, minute, it's worth it on the back end. If you want to get better, then this is one of the things you're going to go do.
Every single commencement ceremony we have at the end of our program, the folks that have gone through our program, just looking in their eyes, hearing their story, hearing how much more hope they have now moving forward, I think that's the impact that we're making. I think we're saving people's lives, I think we're saving families, and I think we're really going to make a larger impact than I think any of us realize right now.